Omega-3 fatty acids are essential polyunsaturated fats that our bodies cannot produce. They must be obtained from external sources. The three main types are alpha-linolenic acid, ALA, eicosapentaenoic acid, EPA, and docosahexaenoic acid, DHA. ALA is found in plant-based sources, while EPA and DHA are primarily found in marine animals. Although the body can convert ALA into EPA and DHA, this process is highly inefficient. Therefore, obtaining EPA and DHA directly from dietary sources or supplements is crucial for optimal health. Omega-3 fatty acids play diverse roles in the body. They are key components of cell membranes, especially in the brain and retina, influencing fluidity, signaling, and inflammation. DHA is particularly concentrated in neuronal and retinal tissue, contributing to cognitive and visual function. EPA is involved in modulating inflammation and regulating vascular tone and platelet activity. Both serve as precursors to signaling molecules such as prostaglandins and leukotrienes, giving omega-3s their often-cited anti-inflammatory potential. However, this effect is modulatory, not pharmacologic, and should not be confused with drug-like anti-inflammatory action. Omega-3 deficiency often goes unnoticed, but may have long-term consequences. Chronic low intake has been associated with cardiovascular risk, mood disorders, impaired cognition, and skin dryness. On the other hand, excessive intake, especially doses above 3 grams per day of EPA and DHA, may carry risks such as bleeding tendencies, immune suppression, or gastrointestinal discomfort. High-dose use should always be medically supervised to avoid these potential adverse effects and ensure safe consumption. The effectiveness of omega-3 supplements depends on form, dosage, and the individual's health status. Most commercial supplements are derived from fish oil and contain EPA and DHA in various forms: triglyceride, ethyl ester, or phospholipid. The triglyceride form is considered the most bioavailable. Ethyl ester forms are more common but less efficiently absorbed, especially if taken on an empty stomach. Krill oil, rich in phospholipids, may offer better absorption but is more expensive. Therefore, choosing the right formulation is crucial for maximizing the benefits of omega-3 supplementation. Large-scale randomized controlled trials have shown inconsistent benefits of omega-3 supplements in healthy individuals. For primary prevention, meaning the use of supplements in people without existing cardiovascular disease, the evidence does not support a significant reduction in heart attack, stroke, or mortality. However, for secondary prevention, especially in individuals with high triglyceride levels or known cardiovascular disease, there may be modest benefits. The Reduce It trial in 2019 demonstrated that 4 grams of pure EPA per day reduced cardiovascular events in high-risk patients already on statin therapy. In terms of brain health, some evidence supports a role for DHA in early cognitive development, particularly in children. However, data on its effectiveness in preventing dementia or improving cognitive decline in the elderly remain inconclusive. There may be a role in supporting mild depressive symptoms or attention deficit disorders, but omega-3s are not substitutes for antidepressants or standard psychiatric treatments. Therefore, while omega-3s can support brain health, they should not replace conventional therapies. Plant-based omega-3 sources such as flaxseed oil, chia seeds, and walnuts provide ALA only. Due to poor conversion to EPA and DHA, these are inadequate for those with high omega-3 needs. For individuals who avoid fish, such as vegans, algae-based DHA supplements offer a viable alternative. These contain DHA and sometimes EPA, depending on the product, and can fulfill the needs of plant-based diets. Thus, algae-based supplements are an effective option for those seeking to maintain adequate omega-3 levels without consuming fish. Who actually needs omega-3 supplementation? People with existing heart disease, elevated triglyceride levels, or low dietary fish intake may benefit the most. In pregnancy, DHA supports fetal brain and eye development. In contrast, healthy adults who eat oily fish at least twice per week often do not need supplements. For them, capsules may offer no additional clinical advantage and can lead to unnecessary expense. Ultimately, a well-balanced diet that includes cold water fish remains the most efficient and evidence-based approach.